Thank you. Good evening, everyone. We would like to wholeheartedly welcome each one of you for the 123rd session on the topic Brain Health Matters, a deep dive into neurodegenerative disorders. And this is on behalf of the different organizers of the Deccan Positive Mental Health group, which has Manas Shubhakara Mind Care Hyderabad, Yellow Pond Counseling Center India, Forest Creative Arts Studio Punjab, Sri Deepthi Counseling Center Hyderabad, Global Learning Center Hyderabad, Srisha Counseling Center, Kozhikode, and the Mindstyle Hub of Kolkata. Very happy to introduce our resource person to you, Dr. Shripriya Shatji ma'am, who's a passionate researcher and clinical dietitian. She has done her dual master's degree in dietetics, FSM in psychology. She's obtained her doctorate in counseling psychology. She has an experience of working for over 2 decades in multi-speciality hospitals in both Chennai and Kozhikode. Her scientific publications have figured in 18 international and national journals. She has also 13 scientific presentations to her credit. She's a founder of Srisha Counseling Center Kozhikode, which is affiliated to the World Mental Health Federation. She works with individuals, groups, and organizations to amplify their authenticity and empower them to become a better version of themselves. As a part of a social responsibility, she has founded the Women's Mental Health India wing, which deeply serves for the women genders specific issues. She's also the co-founder and secretary of the Community Nutrition Forum in Kerala, which serves in creating food education among the community. She's an active member of Neuro Nutrition Core Group, IAPN India. She's also a renowned speaker, and her signature topics are women's empowerment through nutritional psychology, nutritional neurosciences, child development, wellness, and self care, managing anxiety and stress, prioritizing mental health through good nutrition, healthy periods. She's also a columnist and a reviewer in an international magazine, Mind Matters, and she has spent good number of healthcare articles in other magazines too. She's delivered more than 500 health talks for the general public at various community health programs. And with that very short introduction, I would like to hand over the session to you, ma'am. The floor is yours. And besides that, ma'am has an MSc in psychology, MSc in DFSM, PhD in counseling
Ma'am,
psychology,
thank you.
and she's from Shinsha Counseling Kozhikode.
Thank you.
With that very short introduction, I would like to hand over the session to you. Over to you, ma'am. Floor is yours.
Thank you so much, ma'am. Thank you for the very detailed introduction. Very good evening to each and everyone here. I think my screen is visible to all.
Yes, ma'am. It is visible. Yes.
Yes, ma'am.
Yes. Like I'm not able to make it full screen, so I have extended the screen as much as possible. Just 1 minute, I'll hide the tool also, so it will be bigger. Yes. Okay. Very good evening, everyone. Today I have picked this topic specifically when Sunanda ma'am said I have a session today. Tomorrow is September 21 is going to be World Alzheimer's Day. It is created for creating awareness in Alzheimer's disease. And this whole month of September is celebrated as a month for National Nutrition Awareness, National Nutrition Month, or we call it Poshan Ma. It is celebrated for the whole month since September 2018. So this is all mainly on the purpose is creating awareness and improving our overall health. So thank you DPMH team, Dinakar Rao sir and Sunanda ma'am especially for giving me this wonderful opportunity to have my session today. Thank you so much, and thank you for all the participants to joining me today. Today I'm not going to be a very technical presentation. I'm going to take you into a interesting story. I don't know how many of you have read Alice in the Wonderland. So now Alice is going to be entering into the. I think some of you or few of you have read my Alice series stories earlier, which is like Alice in the Wonderland. So today our Alice is going to have a deep dive into the neurodegenerative diseases. So let's move on. Brain health matters. So what are the things I'm going to take you into this story series? So our content in the story, or maybe what we call the chapters of the story, is going to be down the rabbit hole. Here I'm going to have a brush up because we all are a psychologist and we know much about the brain, but I'm going to just give a brush up on the role of And Queen of Hearts, as per the Alice story, Queen of Hearts is going to be the wicked woman. So she's going to be inflammation and cognitive decline areas. And the Cheshire gut, it is all about gut-brain axis. We had, I don't remember whether DPMH we had a gut-brain axis, but I have like give you a small introduction to gut-brain axis. Then I'll also take you to the neuronutrients, physical activity and sleep. It is going to be Tweedledee and Tweedledum. And finally, we'll have the tea party also. Definitely during the dinner time, we should have a tea party, right? With the Mad Hatter. So shall we move on to the story? So most of us know what is the brain and how it controls, and like every day we are seeing the complexity of brain, and we are undergoing, like every day we are having a greater discussion on how to move on with our own brain or others' brain, how we working on. So daily, this extreme complex organ, which is going to make you every day, like every system, every function, including our sleep and wake actions, it controls. So he is the master, we can call, and this particular brain control or responses and how it functions has like from physical, emotional, cognitive, personality, and motor skills. So it involves and controls everything, including whether you have to go for a urine or toilet. So as per the psychology, we particularly talk on the 6 functions on the brain: thinking or cognition, perception and sensing, emotion or feeling, behavior, physical or somatic, and signaling, being responsive and reacting to the environment. So I'll just quickly brush up on what is the brain, how it is made, the physiology of the brain. The brain is composed of the cerebrum and cerebellum and the brainstem. So the cerebrum has both right and left cerebral hemispheres. So we all know that it has a like 100 million of neurons of the brain, and this neuron cell bodies or gray matter is at the surface, and it has the folded structure beneath the gray matters or the long myelinated axons, which make up the white matters of the cortex. So the foldings of the cortex is the increase of the brain surface area. Each fold is called as convolutions and gyruses. And this cerebrum has different lobes: frontal lobe, temporal, parietal, occipital. So each lobe may be divided into different areas, and that has, every lobe has a very specific functions. Like for example, we have the cortex functions or visual functions or auditory responses, such things. So what are the physical or physical involvement is like our personality, behavior, emotions, and it's also responsible for judgments and planning our problem solving ability, how to speak, write. That is called Broca's area. Like how we move our, like voluntary or involuntary, how you just hold your hands or eyes, blink, anything. It is involved, responsible for it are mainly the intelligence, concentration, self-awareness. And the parietal lobe is responsible for interpreting languages and words, sense of touch, temperature and pain, like sensory strips. It interprets the signals from visual, hearing, motor, and sensory memories. Also, like facial and visual perceptions are always involved in the parietal lobe. So occipital lobe it has very clear cut only towards the visual. It interprets the vision, like color, light, movements, how it understands, how it perceives, all those things is by the occipital. Temporal lobe involves in understanding the language, memory, hearing, mainly hearing, sequencing and organizing what it hears, how it gets. Like when we see in the learning disability, we can see how the changes of these lobes affects the understanding or perception of what is said to them. When we say like write in the upward direction, they will write in ulta or reverse order. All these things is because of the difference in this. So cerebellum is the blue region. It is located under the cerebrum. Its main function is like coordinating with the voluntary muscle movements and maintaining the posture and balance. Like whenever a person is having the vertigo and kind of things, their cerebellum is affected. So the brainstem includes the midbrain, pons, medulla oblongata, and diencephalon. So in the picture, I have given them the same color of the picture. So I have used the same color for the pons. So you can see the green one, diencephalon, midbrain in the yellow, pons in the blue, and medulla in the violet color. So I'm not going into the very detailed physiology. So this diencephalon lies at the top of the brain cell stem under and between the cerebral hemisphere, which includes the thalamus and hypothalamus, optic tracts, optic chiasmas, and mammillary bodies, posterior and pituitary glands, especially the glands are there. So why is this hypothalamus I have to highlight? Because this is the master control of the autonomic system, especially like hunger, how the hunger is induced, triggered, whether the person is full, sleep, awake, and what is the necessary need of electrolytes balance, body temperature, or sexual response, and secretion of hormones in the pituitary gland. All these things are like controlled by this master controller, and thalamus serves as the central relay stations. So he plays the key role in the pain. Some people like having too much of pain tolerance is very less, or some people, they say when even the pin drops, they will wake up. Some doesn't know, like once they are asleep, they are like a dead weight. So this is controlled by the thalamus. Key role in pain, touch, temperature sensation, as well as in the attention, alertness, and the memory. So this corpus callosum is very important in the facilitation of the communication and the both the hemispheres. So it communicates between the white matter structure, which is like consisting of 200 to 250 million myelinated axons. I'm just skipping certain physiological slides because there are so many things we have to talk about the degenerative diseases. So we all know the cranial nerves are also important part of the brain, and what are their functions is like is listed here. Mainly olfactory is for smell, optic is for sight, oculomotor is for movement. With this cranial nerves, we have to always remember this, because not only in learning disability, in the second, like we call it neurodegenerative diseases, most commonly happens, like especially when in the case of Alzheimer's or dementia. At present, we are seeing on the senior citizens, what is the second childhood. So these functions which is affected has to be always remembered. So trochlear is movement of eyes, and trigeminal is face sensation. Like especially in Parkinsonism and Alzheimer's, we can see the facial sensation is affected, or the saliva is affected. Hearing balance will be lost, and taste and swallow also differs. We will say like they are not liking home foods. They are like asking for more of salted foods, kind of things. No, this taste and sense is also affected, and movement of head and tongue is also, and even you can see them like trembling in the hands and trembling in the neck, like they will be keep on doing like this. So these sensations are all dealt by the cranial nerves. So Queen of Hearts is a wicked lady in the Alice story. So when the Alice enters the Wonderland, she'll be like trying to block the way. The same thing now, she is blocking our neurodegeneration and causing problem in the things. What is neurodegeneration? Loss of nervous structure and function is called as neurodegeneration. These neurons, that building blocks of the nervous system, including the brain, spinal cord, and when it damaged or dies, it is called neurodegeneration. The neurodegeneration is the key aspect of large number of diseases. Like they call altogether, it is called as neurodegenerative. It is a neurodegenerative diseases is a umbrella term used for Alzheimer's, Parkinsonism, ALS, Huntington disease, all those things. So these three diseases manifest with the different clinical features. The disease process at the cellular level appear to be similar. So what is Alzheimer's? This is the like one among things. Recent studies are saying that Alzheimer's is also, they're calling as type 3 diabetes. So it is the most common type of dementia, typically affecting people over the age of 65. But now the recent studies are saying it is happening even at the age above 50. Like when the person is reaching their, or before reaching their old age, it's characterized by the accumulation of neurofibrillary tangles, and the beta amyloid plaques in the brain. Although these may be the consequences of degeneration process rather than the cause. The plague impacts the function of hippocampus, and the patients can have extensive loss of nerve cells, that is disrupted synapses and altered neurotransmitter functions. So they will be like, what happens with them psychologically? Difficulty in recalling the information, like they may even forget their own date of birth or marriage anniversary date, their children's names at times, their own names, and all such things. And they progressively decline, experiencing errors in judgment, thinking, and speaking. So, what are the symptoms? Memory loss, changes in the memory, forgetting words, problems speaking, reading, writing, and even understanding at times, disorientation in the time or the place, what is happening now. Sometimes they go into the wrong houses, or they will say that this is not my place. Such kind of things happen. Poor or decreased judgment, they cannot analyze any of their problems, and abstract thinking is becoming difficult, misplacing things, and drastic changes in the personality. The person will be totally changed from what they were before. Like when we talk about Alzheimer's disease, I really wanted to tell one story because we are all psychologists. This I read in this internet only. So I don't remember which social media platform I read it, but there was a story like once a old man has gone to a doctor and he will be like in urgent to get back to home. So others will ask, what is your urgency, whether you have to go for duty or something is still there. So he will be saying, no, my wife will be waiting. So what is there the problem? Let her wait. No, I have to go and give her food. So this others will ask why she can't take her own food. Then he'll say, no, she is affected with Alzheimer's and she will forget everything. So I have to go on time and give her food. So then one person will ask him whether she remembers you. He'll say, no, she doesn't remember me at all. Like for years it has been, she doesn't remember. So then the opponent will ask, then why are you running behind her? She has already forgotten you. This man will very politely say, she might have forgotten me, but I have not. So this story is always a very striking reminder when we are coming across such people. It might be our grandparents or parents or any our relatives or our friends. Always remember they might have forgotten anything, but not us. So be kind to them, be cordial to them. It is not their problem, they have forgotten things. It is their brain's problem. So let's move on to Parkinson's disease. This is another very difficult disease. Like carrying this patients will be really the caregiver stress. I have seen very more in the caregivers of Parkinson's disease because it is a very progressive degeneration characteristics or a cause of tremors, difficulty in balance. They will not even have balance to walk for a small feet of distance, coordination, and they also have muscle stiffness. If you want to give them a bath or if you want to give them a massage, also the muscle will be very stiff. Dysfunction occurs with the syncytin, a protein involved in synapse trafficking and neurotransmitter release. But mitochondrial dysfunction, the inability to clear proteins from the brain, and neuroinflammation are also the key features for this Parkinsonism diseases. PD is characterized by atrophy of the frontal cortex, depth of dopaminergic neurons, and enlargement of brain ventricles, which damages brain tissues. Lewy bodies and neurites, as well as beta amyloid plaques, can be present in this condition, brain cells. So already I have said about the motor symptoms, like they will be like having the head forward, like moving like this, and dropping of the eyelids will be there, open mouth, the saliva will be secreting, or drooling will be very common, and tremors of the hands will be very difficult. They cannot like hold their hands for some time. They will be very slow and stuffing in everything, and they will keep a very short steps. They cannot even walk in a longer steps. So this is like not only their cognitive functions, also the muscular functions will be totally impacted. So the next another disease is multiple sclerosis. This not only happens in elderly age, this also starts in the very young age, children and all. It is a chronic neuroinflammatory, progressive, and degenerative disorder of CNS characterized by the demyelination of nerve fibers of the brain and spinal cord, affecting people like 20 to 40, at the age of 20 to 40 years. initially triggered by a virus in genetically susceptible individuals. This is the basic cause. Subsequent antigen antibody reactions lead to demyelination of axons. So the common symptoms: fatigue, weakness, depression, dizziness, unsteadiness, memory change, pain. Pain will be very intolerable. Spasticity will be less, and tremors, ataxia, speech disturbances, double vision or vision losses also are the, especially bladder and bowel dysfunction is also the common causes. The next degenerative disorder is ALS, amyotrophic lateral sclerosis. It is also again, most of the degenerative diseases are very progressive. They are degenerative but progressive. Affects the nerve cells and spinal cord, resulting in muscle weakness. So these has like a, it has associated with the biochemical changes responsible more than 70%, and this dysfunction in DNA repair, mitochondrial dysfunction, and glial cell functions contribute to this motor neuron decline. So patients with ALS have protein aggregation between the neurons, and TAR DNA binding protein will be common. Another degenerative disorder is Huntington disease. This is not very common in our part of the world. Still, it is like another rapidly progressive neurodegenerative disease leading to dementia, typically present with the alterations in mood as well as change in character, effects in memory and attention, progress to the movement disorder consisting of involuntary and rapid motions, usually not recognized until the patient is in their early 30s, but it may be even diagnosed even before that. There is 50% of chance that a child whose parents have a Huntington will have this disease. So this pathology also includes the abnormal protein as like excess of mutated proteins interfering with the neurotransmitters. The brain normally sends message to the basal ganglia and cortex movements, and this is very not like very much lack of physical activities, dietary problems, and the swallowing difficulties will be very high in the children with these problems, and they can also have the constipation, weight loss, and depression possibilities are there. So what are the symptoms? Again here, the twitching, balance problems, and tracking problems, rigidity, and movement problems are the very common things. And when in Huntington's, the cognitive ability to concentrate will be very difficult, and they have difficulty in driving, keeping track on things, what they kept and where they kept, and decision making, and all those things will be having problem. And the basic problem is with the life skills, like a matter of judgment, memory, cognitive functions will be deteriorating, and they also have dementia. So very common psychiatric problem is early psychiatric symptoms are depression, hostility, irritability, and inability to be pleasured, always negative, lack of energy, and they also will have a hallucination. So what about the Cheshire cat here? How is going to help us in the neurodegeneration? Gut brain axis is one of the important, because they in traditional medicine they have believed only with the medication and other things, but now they are saying that it should be like interrelated concepts. So gut brain axis is coming in, taking in the main role, and they are saying that microbiome is taking an important role in brain health. So taking care of our gut bacteria is very, very important if you want to have a healthy brain, a healthy emotions, and healthy mood. So even cognitive functions. What is microbiome? It is a collection of the microbial genes and microbes. There are so many, like more than 150, 100, 300 millions of bacterial genes in there. And what is GI? Gut axis is commonly are large intestine, small intestine, duodenum, stomach, altogether makes the GI tract. So what is the microbiota's functions in our body? Mainly it is a protective function, structural function, like fermenting and synthesizing vitamins or dietary fibers into short chain acids. Like basically they give energy and improve the well-being. So why this gut microbiota or gut brain axis is important when it comes to memory loss or neurodegeneration? Because the vagus nerves are directly involving or communicating, the bidirectional communication we call it. It alters the person's brain function, including cognition. Mainly they alters the functions of mood and emotions. So it impacts the central nervous system, autonomic nervous system, enteric nervous system, hypothalamic pituitary adrenal axis. So altogether, the communication will be two-way communications. So this neurotransmitters, especially the neurosynthesis and GI functions are very important because neurotransmitters like GABA or norepinephrine, acetylcholine, and serotonin, they are all released in the CNS and spinal cord. They have the very important function like relaxes lower esophageal sphincter, decreases the motility, increase the contractions, and inhibits the secretions, facilitates the secretion and peristalsis. So how this is the bacteria is having a direct relationship with the neurotransmitters? Yes, they are saying that neurotransmitters and the bacteria is having a very direct connection. Again, these are bidirectional connections. So especially these two, Lactobacillus and Bifidobacterium, has a more connection, and Candida kind of Streptococcus and Enterococcus also having a. Most of the bacteria are connected with the neurotransmitters. Gut hormones and neuropeptides also directly involved. So like we also say, how the hunger and our eating problems are all directly involved because of the different hormones released in the body. So neuropeptides, especially this NPY, is taking more of its role. So as Hippocrates says, intestine is the paradise of most of the diseases. We have both friendly and unfriendly bacteria, and dysbiosis may impact more on our mental health. So what are these mighty giants and tiny vendors here? They are neuronutrients. This especially carbohydrates. When the person is malnourished, they will not be able to get into the good amount of brain health. So always take a proper amount of balanced diet. Carbohydrate, protein, fat has to be balanced. If there is any confusion as age grows, we have to connect with the dietitians or qualified people for this. And I'm not detailing on this as time is short, but the very important thing I want to tell is the brain blockers, the trans fat, because most of us are eating out nowadays because we are having a rat race. So always be watchful about what you eat. So involve more of proteins and other things which is homemade and home cooked. If not possible, eat steamed, boiled, and cooked properly foods, not the foods which is packed or sourced from outside. So what are the Tweedledee, the twins of the brain health? Physical activity and sleep are the very important twins. So very important, like nowadays I see two sides. Some people do not exercise at all, some people exercise too much, and some ask what is the reason. You are asking, psychologist asking us to exercise because it is very, very important. It improves the production of neurochemicals. After 30, so many disconnects exercise, and after retirement they start again. It should not be there. Everybody should do exercise at least 40 minutes in a day. At least 4 days a week is what WHO says for us. So it improves the memory and planning, multitasking. So another Tweedledum I have brought in as a very important concept, sleep. Nowadays, it is not only teenagers or children lacking sleep, even adults and elderly people, older adults, are missing sleeps because of binge watching. Please reduce the binge watching. Sleep is very, very important for the brain health and functions, and it only helps us to the brain. As much as it rests, the brain can repair itself. The plasticity will increase and it can adapt into the new things. So it can self regenerate itself. So sleep deprivation is causing not only physical problems, also the mental health problems and neurodegenerative problems. And when if you are doing certain things, your sleep and physical health, not only physical health, mental health is affected. So always have a watchful sleep habits. Stress and anxiety also will cause problems. Medical condition will also cause sleep deprivation. Shift work, more than anything, substance abuse is one of the factor causing problem with the sleep habits, and environmental factors involves. So always have the balance in the diet, exercise, and sleep, so we can increase your performance, energy, and vitality. So when we talk about exercise, it is not only like aerobic or isometric. Also do the flexibility exercises. Always go for the yoga, but never go for the challenges. Do it in minimal. So what are the important things we have to entertain our brain? we have to understand life is not a rat race. Rat race is a very biggest problem today's world, modern life, because we are not even bothered about we think that these are the necessities of modern life. We have to do like this, but constant pursuit of external validation and materialistic goals is going to leave the individual unfulfilled, and this is also is the major cause of neurodegeneration in our brain nerves. So researchers are showing that stress, anxiety, and depression is also causing such problems. External achievements is not going to improve your inner well-being unless you are going to improve your inner self. Competitive nature is good, but it should focus on yourself, not on the basis of comparison and envy. So very, very important is mellow down and let it go. Connect with the present. When as we grow old, we should always start forgiving and forgetting the past. That is very, very important. Once you forget or stop holding your grudges, you can connect with the present. So let it go. Wise will always let go all the grudges, because it is not going to help the opponent, it is going to help ourselves. That brain of yours need to rest. So never hold any grudges. Involved into some artistic work which you were doing since the very beginning in the childhood days, at least spend some 30 minutes in a week or 1 hour in a week involving yourself. Don't just watch in the movie or in the reels. You try doing it by yourself. Do dot joining. This is the one important and beautiful technique. This works in a lot of dementia patients. So do dot joining in any. This is a traditional South Indian pattern of dot joining. We can even do with the A, B, C, D's or any alphabets. You can numbers. You can do the dot joining methods. This is another interesting things like picture Sudoku or number Sudoku. Number Sudoku might be difficult for some elderly people. So you can use them like kids. You can use them with the picture Sudoku, so they can able to improve with their progressions. And maze game is another important game which can help in the cognitive restructuring. Thank you so much. Is there any questions?
Yeah, thank you so much for a wonderful, very, very useful and insightful session. Interesting one also, Sripriya ma'am. Thank you so much. Friends, if you have any questions, you may go ahead. Please raise your hand so that you can call out your names.
I'm sorry. I was thinking the session time is 6 to 7, and I was rushing through the last PPTs. If you want to detail any of these sections, I can detail now. Just now, I was recollecting it is going to be 6:30 to 7:30.
No problem, but you have covered very beautifully.
Thank you, sir.
Some questions are there. Anita, you have a look into the. Padma Nanjar has raised her hand.
Yes, Padma has a question. She says, are these diseases hereditary?
Some are hereditary, but nowadays the recent researchers are saying it is not only hereditary, it is also because of the lifestyle, especially Alzheimer's is found to be lifestyle patterns are impacting. And even in Parkinson's, they used to say that lifestyle patterns are having the huge impact. But when it comes to Huntington's and ALS and all, even sclerosis, these things and all, it has more of genetic things.
She just wants you to explain whatever you have explained through the PPT in a nutshell, maybe in short. Padma ma'am.
So which part you want to explain, ma'am?
I think whatever you have explained it during this session, she wants you to explain that in a nutshell, probably in short, if you can do that. Padma ma'am, do you have any questions?
No. She has covered very detailedly. Both one cover nutshell. Ask me question, Padma.
I will try to tell you, as a layperson, if you want to talk about without the scientific facts, what is happening is when we talk about Alzheimer's or Parkinson's, most common thing is the diet we are doing today is going to affect us, because most of us are running everyday basis. We are compromising. The first thing is we think that food is not everything, so we compromise on our kitchens and we forget go on to the processed and other eating patterns. Second thing is earlier we used to cycle or do anything after a certain age. Now, for even the shortest distance, or even for a switching on the TV or changing the channels or switching on the fan, everything is becoming remote control. So the physical activity is reduced. Third thing is the nature of people. They are becoming very competitive, and every day, like the social media also take the toll on our mental health. Every day we are competing with someone unknowingly or knowingly. So we want to become like something. Oh, she has achieved so much, I didn't. We are every day on continuous comparison with others. Fourth thing is very important. Most of us are not sleeping properly. We are compromising on sleep, which is very, very ultimately important. 11 p.m. to 3 a.m. is the time our body regenerates itself. So that is another important thing. And we are not letting go anything. We are holding all our pains, all our sorrows. Some patients come and say me that 10 years back, this date, this time, this happens to me. So holding so much to the problems is not going to help us relax, mellow down. And sometimes what happens, people are doing, even with the yoga practices, I'm seeing people like now it is International Yoga Day and all, they're doing 101 Surya Namaskar. They are challenging, everything is becoming challenge. Don't challenge so much. Just relax and leave, mellow down yourself. Mellowing is a very important concept, because even in yoga, we have both Surya Namaskar and Chandra Namaskar. Traditionally, we have both. So you have to do improve the energy and mellow. That is the very important concept we are missing. These are the very important things to improve our brain health. Maybe is this okay?
Good, Sripriya, good.
Thank you, sir.
Yes, ma'am. We have a question in the them like a child, but we all know it's not that easy to take on the care of elderly. The care of the elderly. What is your call on this?
Ma'am, that's a very honest truth. I don't tell anyone to take care of them as a child, because I have seen my dad's mama and even my husband's mama. Personally, I have seen them getting deteriorated. No, that's a very difficult thing, because we have seen them as a very strong personalities living such a wonderful life, and sudden one fine day, especially in my husband's mama scenario, one day when she's just bed soiled, she got so sick one day after that, because she could not accept the fact that she is sick. This is a very difficult part the child doesn't have. Child is progressing, this is declining. So how can we compare? How can we say care like a child? Don't say this. This is a kind of toxic positivity we are using. Don't say care like a child. Understand, accept. Understanding and accepting is the important. They are growing old. Let us make their days wonderful, beautiful, comfortable. That is what we can do. We cannot make them turn into 10 or 20. Impossible. If you're trying to do that, again you're into the rat race. Don't do that. One of my patients came and said, ma'am, I have seen in internet some England lady has at her 80 after her cancer treatment, she become she has gone into a marathon. Not possible for everyone. Maybe 1 in a lakh can do that, but not everyone. So understand, and this is the Kubler-Ross theory. What she says is, come out of the denial, accept they are growing old, understand what they are, because as they are degenerating, their muscles, tissues, their thinking process, their acceptance, everything, their taste, everything declines. Accept them as they are. It will be very difficult for us too, because the caregivers, because it is not a growth phase, it is a declining phase. So give more better counseling for the caregiver and tell them this is a part of your life. You have to do this. That is where all the therapeutic approaches, art therapy and the puzzle maze, they can sit and talk with their elders. They can we cannot listen to so much of the older stories or repetitions of old things. In that time, they can play with them. They can use carom boards. Board games are very good to play with the elders. Use such things.
Very beautifully you answered.
Yeah, thank you, ma'am. Ma'am, we have another question. Does our breathing pattern affect our brain cells?
I'm not sure about this concept, ma'am.
No, broadly, what they say is pranayama to some extent helps. That is when they talk about breathing pattern. Maybe to some 1% or 2% or whatever it is, some benefit will be there, provided they can do that pranayama. Very tough to do for the elders as they degenerate. I do agree, but possibility is there. Okay.
Thank you, sir. Thank you.
Padma Nanjala again raises her hand. Anita asked.
Yes, two at least. I think Yarini. Just give me a minute. Yeah, Yarini. Please go ahead, ma'am.
Ma'am, I have a doubt about pre-Alzheimer's conditions. When we diagnose someone with pre-Alzheimer's condition, what are we supposed to do? And can we provide them with a snoozle room treatment so that their sensory perceptions can come up?
Ma'am, I couldn't, your voice is very unclear. Can you type it in the chat box?
Padma, you can ask the question as she types.
Ma'am, she wants to know about pre-Alzheimer's condition. Pre-Alzheimer's condition.
Okay. Like pre-Alzheimer's conditions, they are saying it can be diagnosed, but not many are aware, and like most of the cases, it is still yet to be diagnosed. And in the cases of pre-Alzheimer's, what they can do is, as I said, they can come back with their lifestyle. Very important is lifestyle changes, because earlier I mentioned Alzheimer's is now classified as type 3 diabetes, because the dietary patterns and lifestyle patterns also is causing Alzheimer's. So their lifestyle, like physical activity, sleep pattern, all these things has to be analyzed and corrected. That is one way, but still studies are needed. It doesn't have much supportive studies that pre-Alzheimer's can be corrected.
Ma'am, she wants to know about snoozle therapy. There's something called snoozle therapy, which can be given for the pre-Alzheimer's condition.
Snoozle therapy.
Yeah, snoozle therapy. Yes.
Hello, can you hear me, ma'am? There is a
Yes.
small mild network difficulties. Sorry, ma'am, I have not used snoozle therapy till date. So I doesn't have much idea about the therapy. I use CBT, REBT, I use, and again I use artistic methods, psychotherapeutic methods, and art therapy I use. And most commonly in Alzheimer's patients, apart from lifestyle modification, I give them muscle and maze games and puzzle games. That is the very important thing. Sudoku mostly I don't give, like according to the stage, I give them pictures of the core numbers of the mostly I use art and play therapy.
We have a question from Mr. Shiva Kumar. My question is, modern psychology played a positive role on neurological problems like Parkinson's and Alzheimer's disease. So, do you have a question, sir? Shiva Kumar, sir? Why modern psychology played a positive role on the neurological problems like Parkinson's, Alzheimer's disease?
In a traditional way, they use like Gestalt and again maybe RDV kind of practices, which doesn't much help earlier. But now these CBT, like maybe we can call like CBT is the post era. Modern psychological approaches starts with the CBT and other things. Art therapy also, they're saying in the modern psychological approaches. What happens is whether the degeneration is like not reduced, but the delay in the degeneration can be brought in. Like earlier, the degeneration, once the degeneration starts, they are done with it. They are, after that, they will become like a vegetable state. They will be like that always. But with this modern psychotherapeutic methods, what we can do is we can delay that. Once the person starts forgetting things, we can give some mind games. We can do this play therapy method. So we are delaying the degeneration, and maybe we are taking little extra time. That we are not yet able to stop it completely, but we are delaying the process of degeneration.
Okay, ma'am. Shivakumar sir, you raised your hand. Do you have another question? Please go ahead, sir. Shivakumar sir? Okay. Okay, sir. If there are no further questions, with your kind permission, Shri Priya ma'am, may I request Archana to go ahead with the vote of thanks
Ma'am, there is
for the
one
session?
question. One question about sleeping pills.
Okay.
Yes,
There
Just read it out.
There is a question
Yes.
from Padma madam.
But it
Regular use
says,
of
yeah.
sleeping pills for sleep, will it leads to Alzheimer's?
no such studies says that. Like sleeping pills or continuous usage is definitely it is bad for both physical and mental health. But all this substance abuse or alcohol leads to Alzheimer's and such practices leads. But there is no such, as of my knowledge, I don't have any supportive documents that continuous usage of sleeping pills affect.
Okay. Thank you, ma'am. With your kind permission, may I request Dr. Archana to go ahead with the vote of thanks. Over to you, Dr. Archana.
1 minute, Archana,
Thank
wait.
Yes.
Archana, wait. My friends, you have heard a beautiful talk by Shri Priya. I want, if possible, for you to purchase the novel Still Alice, because she's talking about Alice in Wonderland by Lisa Genova. Wonderful book I have purchased. I saw the movie also. If possible, try to do that. Now, Archana, you take care of it.
Thank you
Still
so much.
Alice. Go ahead, Archana.
Thank you, sir. I want to express my sincere gratitude to Sri Priya madam for her incredible, insightful, and thought-provoking session on brain health matters. This inspiring session covered great topics such as understanding the brain, inflammation, cognitive decline, the gut-brain axis, neuronutrients, physical activity, and sleep, and the importance of entertaining the mind using most memorable stories in a short time. In a very short time, these topics have not only enriched our knowledge but also have potential to impact significantly our personal and professional lives, making this session truly valuable for all of us. I extend my heartfelt thanks to all the participants and the dedicated organizing team for enriching our day with this session. Your engagement and enthusiasm has been the driving force behind the success of this session. I want to extend our gratitude also to our esteemed partners, Yellow Pond India, Forest Creative Arts Studio Punjab, Srideepi Counseling Center Hyderabad, Clover Learning Center Hyderabad, Srisha Counseling Center Kozhikode, and Mind Style Hub Kolkata for their valuable support and collaboration on behalf of Deccan Positive Mental Health. I extend my heartfelt gratitude to each and every one of you for your time and efforts. We eagerly anticipate your presence at our next Friday session. Thank you.
Just I want to tell only one thing. Why I use the Alice story in this, because when we have a degeneration, one important therapy we also say is storytelling. My mentor Sudha ma'am also used the story selling on university. She is my mentor in art therapy. So this is a beautiful concept. I can be like trying with the older people also. Try this in your plans also and let us know how it works.
Good, good. The movie also, they're Still Alice. Try to see that.
Yes.
Thank you, friends. Archana completed VOT. Thank you. Have a good Saturday and Sunday.